Hi everyone, my name is Konnor. I'm one of the fourth year medical students at UC Irvine in sunny Southern California. I'm going into emergency medicine, but I couldn't apply into that residency really without passing step 1. And to pass step 1, your micro knowledge has to be top tier. So we're going to walk through a high yield question of a micro board style question that you likely will see on step 1. So what I like to do is read the last sentence first. And so I read the last sentence first and I do not read the answer choices. So which of the following is the most likely causative organism? Okay, that tells me this is a micro question. I got to read the, pathology and figure out what bug or organism, whatever, caused it. Okay, so again, ignore the answer choices for now. I have a 35-year-old male, has a history of HIV, severe headache, fever, nausea, vomiting, altered mental status. Already kind of thinking like meningitis or something, like that. They're very nicely telling me that his CD4 count is 50. That is not good whatsoever. He has nuchal rigidity. Okay, so that already in like, all right, this is meningitis of some sort. They do an LP, which is great. And the CSF is analyzed with an increased opening pressure, low glucose. So low glucose means something is eating it. Bacteria and fungi are the two that eat glucose essentially in the CSF. Proteins elevated and a lymphocytic pleocytosis. Okay. So then they tell me India ink staining of the CSF reveals encapsulated yeast cells. All right, yeast, thinking fungus here. So which of the following caused this? All right, so Cryptococcus neoformans, totally a fungi, totally like an AIDS defining illness and can present with all of this stuff. So this is the highest on my differential right now. Neisseria meningitidis. It can't be this just purely because of the encapsulated yeast cells. This patient is presenting with meningitis or something along those lines. We also don't do India ink staining for Neisseria, so unlikely. Strep pneumo. This is not pneumonia. Yes, strep pneumo causes other things like meningitis, but that's not the most common. Listeria, again, entirely possible, likes to, mess with their brain, but it's a bacteria, not a fungus. And Haemophilus influenza type B, again, not a fungus. So of the answer choices here, the only fungus I have is Cryptococcus, and I also have the additional that India ink is always associated with a Cryptococcus, as well as this super low CD4 count. So let's see if it is Cryptococcus. And it was. So going through here, something I really want to point out that's really important is your HIV or your AIDS defining illnesses, right? So around 500 CD4 count, you want above 500, essentially. A lot more would be great. When we get to around 200 or so, we think of PCP or what was called PJP. You think of Cryptococcus, you think of Candida as well. When you get around 100, you think of toxoplasmosis, Candida, and CMV. And when you get around less than 50, we're really scared when we get below less than 50, but we think of CMV, again, more so, crypto, like we see here, Cryptococcus, and Mycobacterium avium complex, or M. avium. So knowing your typical AIDS-defining illnesses based on CD4 count is really important. But if you forgot that, there's a bunch of clues in here that could get you that way through. So let's pull up the sketch because this is sketchy. And we're going to go through the sketch and things that I find important here. And now I'm scrolling through here a little bit different of a way to do this. But what I want to show you is the immunocompromised cane. Okay, so HIV, AIDS, cancer patients. That's where this is coming from. When we scroll down, the neck brace and the sweating, that's meningitis. And that's the one trying to pull you out, meningitis as well. And then I think the one that is the most memorable buzzword for Cryptococcus, you can remember the meningitis, you can remember the CD4 count, you remember all that stuff. If you see India ink and it's positive, it's Cryptococcus. Choose that every time. That's what your answer is going to be. And so this is where going through the sketch of the important things for Cryptococcus, which is an incredibly important organism to get right on step 1. And the questions, as long as you remain confident, should be pretty easy for you to do. So hope you enjoyed.